Good morning. On behalf of the IDB, the Inter-American Development Bank, and the Pan American Health Organization, I welcome you all to this exciting event, Connecting Health for All. My name is Soledad Planes. I'm a communication specialist here at the IDB, and I will be your host today. This event will be in Spanish, English, and Portuguese. And you can join us live here at the IDB headquarters, at the IDB and PAHO country offices across the region. And we are also streaming live in YouTube, LinkedIn, and Facebook. We have more than 1,000 people registered, so please send us your comments, send us your questions using the hashtag Connecting Health for All in English and Salud Conectada en Español. So this event is about how to achieve connected health for all. And when we talk about connections, we refer to multiple levels: human and technological, connections between individuals, organizations, and governments, connections between the public and the private sector, and also between ministries. Also, we talk about connections across borders. These all to enable better quality, efficiency, and equity in delivering health services across the region. This is what we've been working for the last 5 years with the Pan American Health Organization. Now I invite to the stage to Dr. Sebastián García Saizó. He's the Director of Evidence and Intelligence Department at PAHO, to give us some welcoming remarks.
Thank you very much. Muy buenos días. Tengan todas y todos.
Good morning, ladies and gentlemen.
Del Banco Interamericano de Desarrollo.
To the President of the IDB,
Dr. Jarbas Barbosa.
Dr. Jarbas Barbosa, also Silva from the PAHO organization, director, as well as partners, representatives, colleagues who are all in attendance, and those of you who are connecting with us virtually. I understand we have more than 1,200 people registered. We're here today to commemorate our 5-year journey together between these two organizations, which are considered essential for our region, the IDB, as well as the Pan American Health Organization, are the ones I'm indicating. I feel profoundly honored to be here as we reflect on the achievements of this extraordinary partnership, and as we forge ahead into the future where we will be able to jointly achieve a strengthening of public health in the Americas. In this journey that we launched 5 years ago, I would like to, first of all, extend cordial greetings to all of our attendees, diplomatic personnel, representatives from organizations, partner organizations like AID, Vital Strategist, Bloomberg, as well as the Spanish Organization for International Cooperation, in addition to our esteemed colleagues from PAHO and the IDB, who are also joining us with more than 1,000 attendees. So I think their participation reflects this constant commitment to defending and supporting our communities in the Americas. Our partnership with the IDB has really been the cornerstone in terms of innovations in public health. Together, we have been working tirelessly to address very complex challenges, improving healthcare systems and improving the living standards of millions of people. Our cooperation has become a shining light of hope, so that as we bring together efforts, we can achieve much more than what we would be able to do individually. So the key topic that we're addressing today, dealing with information systems in digital health, which is a key area in modern contemporary scenarios, as we maximize the technologies, digital solutions, all of that is crucial. That leads to greater efficiency and sustainability, as well as equity in providing public health. Our efforts over the last 5 years have given us noteworthy achievements, and we're very proud with the fact that our partnership has been in the forefront of these innovations. Let me just take a moment to emphasize the importance of this partnership and its impact on the Americas. Together, we have helped to facilitate the implementation of information systems as well as cutting-edge platforms that have paved the way to creating new interoperable and interconnected platforms. These joint cooperation initiatives have been essential in our efforts to combat health crises, and it has also empowered communities, strengthening their resilience to face greater challenges in the future. We need to reinforce the message that by working together, it's not only beneficial, but also crucial. The challenges that we face in public health are really formidable, and they know no national boundaries. And it's only through cooperation and solidarity that we can hope to build solid healthcare systems that leave no one behind, and that interoperability will also become cross-border in nature. All of our joint efforts with CDC, Bloomberg Philanthropists, Global Strategies, and the Spanish Agency for International Cooperation, through all of these efforts, we've been in creating a single system of support to achieve greater healthcare results in the Americas. And that's why we invite all of the institutions that would like to join the process, whose focus is bringing together this one agenda, an agenda to benefit countries. This has always been our main guiding path, a region that includes multiple partnerships, a single framework and agenda for actions where everyone contributes for a more resilient public healthcare system and approach. As we look at our achievements, we need to remain firm in our determination to build a more healthy, equitable, and sustainable world. So we can't think of that future without thinking of public health that is developed in this era of digital interdependence, as was defined by the UN Secretary General Gutierrez. Together with this unified force for the common good, we will continue to pave the way in the digital transformation processes in governments, and at the same time have more resilient healthcare systems to come up with more effective solutions. I also thank the invaluable efforts of the IDB as well as PAHO in undertaking an effort that goes beyond individuals and allows us to ensure that this cooperation and the results of the last 5 years have been possible. So from that iconic meeting in Kingston, Jamaica in 2016, both teams have worked jointly in order to create the IS4H initiative, which became the flagship initiative in order to continue to launch greater efforts in healthcare training. So I want to thank everyone for joining us in this very significant event. We continue to mutually inspire one another in our joint efforts, and we like to maximize the potential for digital transformation and health and technology systems. And public health is a cause that is vital to all of us in every corner of the Americas. I'd like to now conclude my opening remarks as we introduce our two leaders who have made our actions possible, in particular, who have paved the way for moving together in implementing these lines of cooperation for the countries of the Americas. Thank you, and hopefully our next steps will be filled with success as we continue to learn from one another, from our partners, our partner nations and institutions, as we continue to reinforce our cooperation efforts. Thank you.
Thank you so much, Dr. Garcia Saizó. Now it's an honor and a pleasure to introduce Dr. Jarbas Barbosa, PAHO Director, and Ilan Goldfajn, President of the IDB. Please join us on the stage. So this conversation about the PAHO and IDB Alliance will be moderated by Jennifer Nelson, Senior Specialist for Digital Health Solutions at the IDB.
Hi, everyone. Good morning. We happen to have two outstanding leaders here with us today, and it just so happens that they're both Brazilian. They say it takes two to tango, but here today, it takes two to samba. So let's get started. Dr. Barbosa, We'd love to hear your insights on the meaning of this alliance for the region. What impact do you believe it will have?
Thank you. First, good morning. I think we are very happy to be here. So we're celebrating this partnership, the last 5 years, producing many important outcomes for the region, and we expect for the next 5 years, because I think that they will be more productive indeed. So this alliance is very important because I think that it is focused on some problems that the pandemic highlighted. Several ministers during the pandemic, they faced the challenges when they couldn't report to the president, prime ministers, to the public, to the media, how many cases, hospitalized cases and deaths are happening in the last week or the last day, because the information systems for health were too weak in this country. So this, I think, that highlights the relevance that we have, not only during emergencies, but the managers, leaders, they need to know what is happening in the health sector. They need to have information in order to identify gaps, to identify vulnerable population, to identify barriers, and to adopt the strategy to overcome them to guarantee the right to health. And the second, And the second one is that during the pandemic also, 95% of services in the region reported disruptions during the peaks. So we are talking about people with cancer that haven't had the opportunity to get the diagnosis, people with hypertension and diabetes that were not that haven't had the opportunity to follow up appointments. So we are talking about how we can use the tools that are already available in order to guarantee that we have services that can be resilient and can provide access to this population.
Thank you so much, Director Barbosa. Turning to you, President Goldfajn. As we focus on strategic priorities for the Americas and for the IDB, we're eager to know your thoughts on the significance of information systems for health and digital health transformation. How do you envision these initiatives shaping the future of our region?
Thank you very much. For me, it's a pleasure to be here, to be with PAHO, to have these initiatives. It's always very nice when you are part of an initiative that you see is generating fruits and has a bright future. I'm also glad to have here Jarbas, somebody that can talk Portuguese like myself. Maybe it was also Porto English, I don't know. And you said that we are going to dance samba, tutu samba, maybe tutu fervo, I don't know. So we are getting a lot of attention on health. A lot of countries are coming to us, telling us this is something that's important for us, not only because of the pandemics, but the perception of the population that they want more. They want better public services. And we have been saying it, that there is some impatience in the region for better public services, and health is one of them. This agenda that we are building together has some elements of what we believe are our priorities. Let me point them out. First, it's about integrating regionally. We are now thinking about how to make one system connect to the other, how you can be across the countries and be connected. To regional integration, that has been a major push for us and something that we have been saying from day one. Second, it is an initiative that looks at data, looks at availability and effectiveness based on data, and we have been talking since day one about development effectiveness. So that's there. Third, we'll be saying about each dollar making a difference, and that's efficiency. And digitalization, I was just in Europe, where digitalization is a major initiative for Europe, but Europe in Latin America. But not only for Europe, for Latin America, for us. So digital health is clearly something that we want to address to do, to deal with diseases, some non-communicable diseases like diabetes or others. And my team says that if we just invest and prevent 5% of the diabetes case, you could save $7.5 billion. So there are some places where you put your effort and you can get a lot of resources that can be used for other primary care for others. And finally, we talk about a lot of our issues and inequality. If you don't deal well with health, primary care, digitalization, you can bring the disparities to be even larger. So regional integration, data and efficacy, digitalization, and inequality, those are clearly very important priorities for us.
Excellent. Thank you so much. So this question is actually for both of you. As the famous Henry Ford once said, coming together is a beginning, staying together is progress, and working together is success. We're intrigued to know why the IDB and PAHO joined forces in this area. What sets your partnership apart and contributes to its remarkable success? Why don't we start with you, Director Barbosa?
Thank you. Probably these are good recipe for good marriages too. So I think that I think that's important. Also takes opportunity to recognize the efforts that both teams from PAHO and from IDB that is starting working together, responding to a call made by the countries. It was not something that here in Washington DC we identified as a priority. No, it was the countries in Latin America and the Caribbean that told us that they wanted to strengthen their information system for health. So I think that this was the first condition for the success. Second, that the teams worked very well together and identified very concrete actions, robust tool to measure the maturity level of the information system for health that now has been used for 48 countries and territories in Latin America and the Caribbean. So this provides a clear and transparent roadmap to the countries and to PAHO and IDB, where we need to allocate the resources, what are the technical cooperation that you need to provide. I think that this is the main ingredients that made this recipe so attractive to the countries and that are producing so many excellent results in our member states.
Thank you so much.
Well, I like the Ford quote. It looks interesting. Not sure that the last part, working together is a success, is valid for marriage, but it's valid for us. Working together has been clearly a success. And a success because it is based on trust. The institutions trust each other. They know how serious we are. I trust the leadership of Jarbas and the staff and the executives trust each other to advance. So that's the first thing. The other one is what Jarbas mentioned. He says that came from the countries. This is not an imposed solutions coming from PAHO, coming from IDB. Like say, well, we think this is the best for you, whatever you want. No, quite the opposite. It's coming from the countries and the countries are doing. And I have here a set of examples. Several national digital health agenda. The last one, last month, Ecuador. So this is lively, it's happening as we speak. We have an history of good results. For example, to eliminate malaria, where we have one country that was certified to be malaria-free, Belize. So congratulations, Ecuador, Belize, and all the others. We have LACPAS, which is an initiative, a regional initiative to support the exchange of health data across borders. We have 15 countries that are connected across borders, including vaccine certificates for other diseases, test results, and other data. So we do have quite a bit of trust, success in work, and results. And this is also very important. And going forward, we want to do more. We want to connect more between the countries, do more work between us, and more work between the public and the private sector.
Excellent. This is fascinating. President Goldfajn, the next question is for you. The Americas have been at the forefront of progress as partners in various endeavors. From your rich experiences in collaborative efforts, what valuable insights can other regions learn and apply to drive positive change?
So I've been saying that Latin America and the Caribbean should be part of the solution to challenges of the region, but challenges globally. Why we cannot be seen as using our innovations, using our success here to be part of what is good for us, what is good globally. We have three things that we can make and provide attention. One is the technology, but not technology, you just put technology in something that doesn't work. You want to transform healthcare. And transform healthcare means that you care about the people, you care about the processes, you care about technology for the people and for the right processes. That's something very important. Second, innovation. You may be surprised, but we have in the region quite a bit of leadership in innovation. IDB Lab, also countries that have been at the forefront, like Uruguay, that has been quite important, the first country in the region to enable the national exchange of private and public health data. We have countries in Central America, we have El Salvador, that have been innovating. It came from connecting just 5% of the centers, suddenly to 98% of primary health. So those are concrete results, data. What about Guyana? Guyana has implemented telemedicine, teleradiology, telepharmacology, and it has been using satellite connection to reach people in the Amazon. And you know that we have been pushing for a regional Amazon initiative, the Amazon Forever. So in order to have an Amazon that's sustainable, it depends on people. And if you depend on people, they have to be taken care. And if they take care, they need to be connected. So those are very important examples of where we have been, can be an example. And last but not least, we need to invest in digital transformation, including the health record, but also invest in people and processes. So it won't be easy, never easy. You need to do a lot of energy and a lot of resources to work with digitalization, with primary healthcare providers who use these records for the benefit of all.
Thank you so much, President Goldfajn. Turning to you, Director Barbosa. The PAHO IDB partnership in Information Systems for Health and Digital Health has taught valuable lessons. We're curious to know what key takeaways can be adapted and implemented in other domains. For example, can we channel a similar collaborative approach to address critical issues like climate change or to improve primary healthcare within the region?
No, thank you. I think that we have some very, very important lessons learned from these five years that we have partnered with the IDB that we can apply to other areas. We have many countries in our region, in the Caribbean, I think they are more vocal because they are suffering the most important impacts from climate change. The Minister of the Bahamas, for instance, he said almost every 3 years they need to rebuild 40-50% of their health centers because they are devastated when they have a hurricane. So I think that this is really, I think that an area that we can work together. We have worked with the countries in the Caribbean. So far, we have supported them to build around 50 hospitals and health centers using a technology called smart hospitals to make them resilient, more resilient to extreme climate events. So I think that this can be another area because many countries want to increase and to have more hospitals and also health centers in this initiative. And about primary health care, this I think that is crucial that we need to change primary health care. we need to strengthen, we need to renew. The epidemiological scenario nowadays is totally different from the epidemiological scenario that we had 45 years ago when the Alma Ata Declaration was launched. At that time, it was a revolution to say that the health is not the only hospitals, but we need to increase the capacity of the health systems to be present at the community level was very important. But nowadays, primary health care cannot be focused only on child and maternal health. If we are not responding to this high burden of non-communicable diseases, for instance, we will not change the game, because nowadays 30% of the deaths related to non-communicable diseases in our region are preventable and premature. So if we can strengthen primary health care using telemedicine and telehealth to make them cardiologists, neurologists supporting the primary health care team, or to providing telediagnosis, to provide more support to primary health care, we will not have the primary health care that we need in 2023, and we will not change this pattern. So I think that for sure the lessons that we learn during these 5 years can be applied to other regions, because they are also linked to priorities that have been presented by the countries, and that together the IDB and PAHO, I think that can provide a much better response than each institution alone.
Excellent, excellent. The bar is set high, everyone. Finally, everyone, we'd love to hear your hopes and expectations for the Alliance over these next 5 years. What do you envision for the future of this remarkable collaboration? President Goldfajn, we'll start with you.
Yeah, I would like in the next 5 years, we talk about 2023, 2028, maybe to 2030, which is the important milestone. I want what Dr. Jarbas mentioned. Can we deal with the most important pressing issues? Hospitals in one hand, but primary care important. And primary care in non-transmissible disease, things that represent, as he mentioned, 30% of and are preventable. That's huge. Can we do it? Yes, we can do it together with our both expertise, knowledge, not only resources, but also knowledge. We need to do it regional, both sub-regional. So you mentioned the Caribbean. I talk about the Amazon, but the Caribbean is an important region to try to work together to get the synergies. We need also to connect everybody, to connect all the health care places. We need to be able to all be connected so that we can have telemedicine for everybody, not for only a few, which makes inequality a major issue. So when you ask me about the future, the next 5 years, maybe 7 years, we want this to get to our goals, which will be an important goals. But we need partners. So one ask I have from you is, let's be together. Let's try to partner with the private sector. Let's try to partner with stakeholders too. Can we together join forces and bring everybody to the important goals? We can do it. We already have quite a bit of partners with us. Let me thank governments that have been with us. It's always very important to acknowledge when we do have other partners. So governments of Israel, Japan, Korea have supported a lot of our work. We will value more support, and we will value more partners and explore more initiative ways, not only innovative ways to deal with health, but innovative ways to finance this for these targets we have. Number two, we need to think big. We need to build what we are calling here now the Pan-American Highway for Connected Health. What does it mean? The region be connected in a Pan-American way, a highway of connectivity for health. We can do it because we need to integrate the region, and it is important to do it because when you integrate the region, you get the synergies, and institutions like ourselves, we do have the mandate to think about the region. And doing it together is always an important way to do it. And finally, if we want to look at the future, it's always good to immediately start the future. We have been a good past, we have a good present, but as I mentioned in our conversation, you never leave a crisis unused. We have a major crisis, the pandemic crisis, which has a lot of very critical consequences for the region, but that allow us to think and to be more bold for the targets for the future. So I invite everybody to take into account what we have, what our targets, and do our best together to work for the region.
Thank you so much. Dr. Jarbas?
No, thank you. I think that President Ilan has covered so many important things. So let me tell you that besides, I think that supporting everything that he's mentioned as what we expect for the future, I think that I think that in two areas we need to use or to provide the better use of all the research that are already in the countries, the projects that are going on. So we can think about first to have a stronger information system for health. It's unacceptable that some countries in our region, they don't know what is their maternal mortality rate. We need to use estimates because they can't count the number of deaths that are happening. And when you have a high maternal mortality rate, is because the quality and the access of service is totally facing severe barriers in that area. So this is one example, but we can go for, 10, 12, 20 examples. So to strengthen information system for health, thinking that in the next 5 years, every country in the region will have information, data and information, that so they will be able to identify their priorities, to monitor their progress, to identify the gaps, to identify vulnerable population, to improve the access to health, and to have their population exercising their right to health. Second, I think that as President Ilan mentioned, we need to accelerate the use of the technology that are already available, that were tested during the pandemic, so some services could use teletriage or teleconsults in order to provide some kind of access during the peaks, so people were not left alone with their diseases, with no kind of care at all. So I think that now is the moment to use that some barriers or prejudices against technology. In many countries in the region, teleconsults were not allowed by the medical corporates, were against teleconsults. So we were losing the opportunity to using a tool that's so important. So I also think that we need to have all the tools available when we are talking about the digital records, electronic prontuários. We are not only talking about a new tool, but we are talking about something that will improve the quality of care. Because one person will be monitored. If this person goes to an emergency room, to a hospital, to a health center, their medical history will be there. This is crucial to improve the quality of care. But this will also allow us to identify some vulnerable population that are not having access to vaccines, because the health centers are opening from Monday to Friday, business hours, and the parent is now working, and the 50% of the poorest families in Latin America, they have only one adult that has income and is a woman and is working, most of them in informal economy, and so they cannot miss 10 or 12 days of work in order to get their children to be vaccinated. So this kind of new information will allow the health authorities to identify where are these vulnerable populations. This will also facilitate the movement among the countries, as the President Ilan mentioned. That is so important. The yellow fever vaccine now, that in many countries is still required, you have that yellow card to show, and if you forget, you can have a problem. So I think that we are talking about many things that will facilitate the access, that will translate universal health in practical terms, so people will have the right to have the access. So I think that based on what we have built in these last 5 years, I'm very optimistic about the things that we can do together, and to use all this movement and the things that the pandemic pushed us to think about how to overcome the barriers, the difficulties, the disruption of services, and how to use them in a positive way to increment the access and to improve the health of our populations.
Thank you so much. Thank you so much, Director Barbosa. Thank you so much, President Goldfajn. It has been my honor and a privilege to be your moderator, and most importantly, to celebrate this milestone for all of us here. Thank you for your time, your wisdom, and your continued commitment to this important agenda for us in the region for connected health for all. Thank you.
Thank you. Bye-bye.
Thank you.
I would now like to ask Marcelo Agostino, Chief of the Information Systems and Digital Health Unit at PAHO, to join Jennifer Nelson for a recap of his 5-year journey in digital health that PAHO and IDB have been sharing.
Bueno, muy buenos días, gracias Soledad, gracias Jenny.
Good morning. Thank you, Soledad. Thank you, Jenny. As you must imagine, this is truly a challenge to speak after Dr. Barbosa and the president of the bank. First of all, I want to thank Jenny very much on her behalf, send a message to Cristina Pombo, who's had to face a challenge during the weekend and is accompanying us from the hospital, because she's been a key throughout this whole 5-year process. So we send a very big hug to Cristina, who is accompanying us. We're going to be very brief. We have a joint presentation with Jenny and the team to be able to share a bit what these 5 years and a little bit more have meant. And also, I want to thank our PAHO colleagues for their presence. We have Dr. Carlos Espinal, who is President Dr. Fitzgerald, Director of Systems, Piedad Huerta, Director of Country Services. You already heard Sebastian, our Director. And if I'm missing anyone, I apologize. So, well, Dr. Barbosa mentioned this as well as Sebastian, and this is how it all started. There was a meeting which was, we received very strong pressure from the Caribbean, and something very interesting about the Caribbean is that they immediately go in block. So it was a request that started with the Minister of Health of Jamaica, Minister Tufton, that is currently also minister, and then rapidly a decision by CARICOM, and then very quickly adopted by the Organization of Countries of Eastern Caribbean. And we have Mr. Marcos, who was a promoter of this initiative when we started. So what happened after this? We advanced with the Caribbean, and we went to Central America and then South America, following the steps that the countries were indicating.
Seguimos, sí.
Yes, continue, please. So this is a challenge, but it's together. Okay, one more. So there, what did we propose in time? Well, what the president and Dr. Barbosa said, we even documented it. In one of the articles of the bank, we decided to write about what this association means, what it's about. I see that Ilan is also there, who we worked with at the beginning of the pandemic with IDB Lab. Fernando, I'm sorry, I had looked this way. So we defined 3 principles: a principle of convergence, of collaboration, and of coherence. The sense of convergence was mainly technological, but also to go to the countries with one single voice. And this is something that has filled us with much satisfaction. It doesn't matter where the cooperation request comes from. It could come from the IDB or on the side of PAHO. We always say we have to bring the IDB or we have to bring PAHO. That's been a very strong message that has reinforced all the different elements of collaboration that were accompanied with this technical coherence. And that's why we designed products, we designed courses, we designed technical notes. But we also started with the process of carrying out joint trips. And we decided to have a joint mission because a lot of protocol was involved, how to organize the agendas, the programs, who we were going to meet with, etc. So all of this was part of this collaboration and convergence process. That then, as you can see, this is an actual image. It's a real photo from last year. We even published graphic material of joint activities. And this has made the countries feel very comfortable at the time of designing their strategies and national plans. You have the floor now.
Perfecto, Marcelo. Muchísimas gracias.
Perfect. Marcelo, thank you very much.
Para que lo podamos ver.
Can we, if you could please move the slides so that we sit on the other side so that we can all see the presentation. Okay.
In English, just real quick. Sorry about that. It's just that interoperability thing. It gets you sometimes between your languages. So at the same time that, as PAHO was talking about, as Marcelo was talking about, that all this movement was happening in the Caribbean, here at the IDB, we were also taking a look internally about transforming our own approach to the social sector and digital transformation of the social sector. And Luis Tejerina and I were charged with working on leading how we would do this in the health sector. And we took a look back at our portfolio, and it wasn't new for IDB to be investing in health IT, as we called it at the time. But I would say we weren't 100% satisfied with the results we were seeing. We weren't seeing necessarily in every project that an investment in digital health was adding value directly to patients' lives. We weren't seeing, for example, shorter wait times, or improved quality of care, or improved efficiencies, or better continuity of care in all of our investments. So we decided to take a step back and look at that. And we decided at the time that it was going to be really important to form a digital health team. We brought in experts from Canada down to Uruguay to think about how do we transform this vision into realities on the ground. We took a look at how we were investing and how important it was to have balanced investments, as the president said, in digital health transformation across people, processes, and technologies. And we also took an intentional step to make sure we were investing in national digital health strategies at the time. And we knew we couldn't do that alone. And that's when we went to Jamaica. We met Michelle Ruth, we met her team, and we knew we had to call PAHO. And that's when I was able to get in touch with Marcelo. And the question was simple. What if we, the PAHO and the IDB, just work together to support these national digital health strategies and agendas? And I'm happy to say that's exactly what it is. Marcelo mentioned joint missions. We actually, with the ministry, many times would have meetings every 2 weeks, led by the ministry, of course, but joined by PAHO, IDB, and is part of this conversation. And luckily, since then, they haven't been able to get rid of us since. And we've been able to move in other directions across the region.
Sí, ok. Bueno, sí, y ahí fue, digamos, en esa...
Okay, so in that meeting in Jamaica, I was laughing, Jenny, because I remembered that I was in Guyana and I couldn't make it on time because my flight was canceled. I was frustrated because it was our first mission together and I couldn't attend. So I had to join online. What we did from there was work on a process that you're surely familiarized with. We have a meeting of all the ministers of health in the continent. We have an annual meeting that define the public policy. So we agree things in certain areas. We approve resolutions, and once they are passed, they become a mandate that we have in the institution. This happened in 2019. It was the information plan for the Initiative on Information Systems. But something that we always remember with much warmth is that the countries, they make comments on the content of the documents, and that's what happened. In this steering committee or council of directors, the Minister of Health referred to the need, or well, they said, okay, we finally see large institutions working together on a single agenda. So to us, that was fantastic. And I'm also looking at Marcos because the document that he had presented, if I'm not mistaken, from One Health, also had 19 comments. And we were also always very alert to what the countries were saying. In this case, the focus was to highlight this partnership. I like that word a lot. In parceria, in Portuguese, having the Brazilian president. Parceria, it's more than partnership or alliance, it's trust, it's something closer. And I must also mention something important because I see Deborah here, right next to USAID. With USAID, we worked 15 years ago, and it was also very enriching, very innovative. Everything that we learned was wonderful. So thank you very much, Deborah, for all of these years of learning, which in the end we've included in each one of our conversations. And that was shown, as you can see, this year is the last year, and next year we will be presenting the progress report. And what Dr. Barbosa said at the end, and which is important, is to continue to reinforce this and not to lose everything that has been done, as Sebastian said, when this initiative became a flagship initiative branding for the region. So we want to maintain it in the framework of digital transformation of the health sector.
And it was lucky we had those 2 years of partnerships under our belt, because a few short months after that policy was approved, COVID-19 hit. Luckily, because of our partnership, we were able to very quickly move together. We formed a virtual help desk jointly with experts between PAHO and IDB to learn best how we could use technology to fight the pandemic, and also among ourselves. We launched together over 40 knowledge products and tools as part of this work. And we launched our webinar series, Learn, Study, Act, so we could all learn together about this conversation, everything that was happening so quickly. We also talked about the importance of inclusive digital health, and it became the forefront of our agenda together. One of the activities that showcased that was our dedication and our commitment to women champions in digital health, and the importance to recognize that gender, as well as other aspects, are very important when we're talking about inclusive digital health services. But we also took some really bold moves regionally, specifically with support of Roxel, the regional network for digital health transformation between Latin American and Caribbean governments, with SENS. Together, PAHO and IDB supported 8 leading governments for the very first time to exchange health data across borders as part of that LACPAS initiative.
Okay, well, esto es un resumen.
Okay, this is a very general summary. We have more information, but well, working together, aside from the action plan and the information system, we were able to approve 2 policy documents, a roadmap for the region of the Americas on the digital transformation of the health sector, and a policy for the application of science data and the use of artificial intelligence and other emerging technologies. And what Dr. Barbosa mentioned, we applied the maturity level in all the countries and territories of the continent And even something that was interesting as part of the lessons learned is that by having faced this as a maturity model and not an evaluation mechanism, this allowed the countries that were facing political changes, changes of government, did not abandon the initiatives, but they invested to position themselves and to improve the level of maturity that they found. So there were countries in which we did this exercise up to 2 or 3 times, and the way in which it's designed is for the country to apply it without necessarily having to bring an expert or to take an expert to the country. So this is the case that we mentioned about Ecuador. We've been working for over 5 years with Ecuador. We did 2 or 3 exercises, and it finally developed its national strategy for digital, for health transformation. There are millions invested, and the president of the bank already referred to this. And mainly the most important topic are the results that we already have for over 10 countries with formal national agendas on digital health, but with something that is fundamental to us, and that in which the IDB also played a very important role. And it's how to position the health sector institutions in the framework of the initiatives of electronic health. And these are the initiatives that define the national standards. They're the ones that manage large investments in infrastructure. In many countries, they're the ones that are seated at the presidency or vice presidency offices of the republic. And what we need is for the health sector to have a voice authorized in the framework of these movements for government digital transformation. And also the number of joint activities with guides, knowledge capsules, virtual courses. We have a recent one on telehealth with over 3,000 people registered, technical notes and publications that have been downloaded over 50,000 times now, as well as seminars, courses, etc.
All this, of course, is the most important, is actually more people receiving inclusive digital health services. You can see here by the flags represented here, the 20 countries that we've been working together across the board, and we hope that more countries every day are also joining this alliance. So to wrap up here, clearly a lot has been done, but there's a lot more left to do. We've had the privilege and the honor to witness firsthand many of the connections that you all are creating, from lab systems to pharmacy systems, between health centers and hospitals, to community health workers, to patients. We've been patients ourselves, benefiting from these important changes that governments are leading. But to think, I'd like you all to think about something that Marcelo and I reflect on, if not weekly, if not daily, at least weekly, when we're working with our partners in the region. It's to think about what is the future state of our region. We heard from our leaders today their vision, and we have an opportunity here to really change things for our region. And we can think about the future state of our region with less connections and more divisions, or we can think about the future state of our regions, in fact, with reaching 100% of our health centers with universal connectivity by 2030, with more people receiving inclusive digital health services, or in fact, establishing the Pan-American Highway for Digital Health and making America as a region for health without borders. We leave you with these quotes from our 2 leaders that we heard today. I hope we can see here the alignment of their vision, their commitment to health, their commitment to digital being a transformational part of that work, and also the possibilities that they see for our region. So I just can't thank all of you enough for being here, for celebrating this moment for us, but most importantly, taking the next steps forward to join this alliance and to see what we build next. Thank you so much.
Thank you so much, Marcelo and Jennifer. Looking forward to seeing what the future of this alliance looks like. Now, Irene Arias, CEO of IDB Lab, will share with us a few words of what it means to innovate in digital health in the Americas. Irene, the floor is yours.
Buenos días. Bon dia. Good morning.
Good morning.
Thank you. Thank you so much, Ferdinando, Pablo, Jenny, and Marcelo, and all the colleagues at PAHO, and all the partners that are present here. It's really an honor for us at IDB Lab to share with you some thoughts from the perspective of innovators and entrepreneurs across the region that are developing that next generation of solutions that with the strategy and the vision that we just had could make possible that goal that Jenny so eloquently shared just now. And it's that combination of the innovative entrepreneurship spirit of the region that we can promote from IDB Lab as the innovation and venture capital arm of the IDB group, but that if it wasn't for working together with a clear agenda and the drive from the public side to put forward this vision and this public policy and this framework, it wouldn't scale. We wouldn't have the impact. And so I'm so grateful to be here. As Ilan Goldfajn said, we shouldn't let any crisis go to waste. And I have to say that it was always our intention to work this closely together, but it is when COVID hit that we completely transformed the way IDB Lab and our and the health team of IDB work together. So I just want to acknowledge that and say we are ready to work along with you for the next 5 years together. So congratulations on this milestone, first of all. And we've heard the word innovation. We've heard it many, many times already today. So I just want to reflect a little bit about what that means and why we care. It's just a tool. It's not a means to an end. It's just a tool. But we realize that it's a very concrete opportunity, like Dr. Barbosa said. It's built on very concrete milestones that we can see the impact that it's had. And because of that, we expect that the digital health market in Latin America and the Caribbean could be worth $20 billion by next year. So going from representing less than 1% of the total invested capital and venture capital in the region so far in the last 5 years, it's growing exponentially now. And like health tech companies attracted much more financing in the last year that represented a growth of 4,700%. The base was low, but it is a trend that we continue to see. This growth was primarily in some of the areas that we heard just now, in telemedicine and in remote monitoring, but also very importantly in health insurance at lower cost, more affordable and reachable for particularly low-income population. One challenge: a lot of this entrepreneurial drive and investors are focusing in Brazil, Mexico, and Colombia, and we need to foster that same pace of growth in the rest of the region. Now, so here about what I was mentioning in terms of the business opportunity, the rate of growth, where are the main areas of investing so far, and the challenge of the high concentration geographically, and the opportunity that we have together to address that. Now, again, innovation is it's always challenge when you just fall in love with the solutions. We have to fall in love with the problem. And I think this is, again, why working alongside PAHO and IDB and bringing that knowledge is so important, so that we focus on the challenges where we could make the biggest difference. Non-communicable diseases was one that was mentioned. So prioritizing is extremely important, and working together in that sense gives us that focus, so that we don't spray and pray on many solutions that may not really move the needle, that we actually focus on the ones that can make the biggest difference, especially for poor and vulnerable population. And again, non-communicable diseases is one of them that was mentioned, and that we're certainly going to focus on. This is also something that will allow us to, with this private-public partnership, so bringing private solutions that can help the public service be much more effective, free up resources. Ilan gave a few figures earlier about how much you can free up if you do that, and then you can reinvest it in making those services more productive and better quality. And I guess 3 attributes that are essential in any innovation, but for health are absolutely even more essential. Number one is this public-private partnership. There is no way we would reach the results that we are reaching by investing in startups, in entrepreneurs, in prototypes of innovation, if it wasn't for the public side, for the fact that we're working with the public side. Secondly, again, that we need to, and by the way, our president, Ilan Goldfajn, mentioned LACPAS as one of these examples, and I'm so happy that we can celebrate these 5 years with that example under our belt. That is one of the innovations that was built on the LACChain network, which is a blockchain ecosystem that we promoted with 60 other partners from IDB Lab, and that is available for solutions like LACPAS that can be built in a secure way, in a scalable way, and also keeping very much in mind the importance of data privacy and responsible use of data. So in terms of the second attribute, it's about not leaving people behind. I think there is a real apprehension, and it is very, very understandable, that all these bet on digital health may leave many people behind because you don't even have the basic connectivity. Then you don't have the tools to access a telemedicine solution, and there is a lot of apprehension. So designing from the beginning a roadmap that takes into consideration all the building blocks that are necessary for the solutions to be truly inclusive is very, very important. And we've seen it even in Brazil with we're helping in groups of indigenous population prevent blindness and visual impairments with an innovative model with portable and smartphone attachment to medical devices and with AI, and this is being now delivering eye care and contributed to universal health coverage, and it is possible because we are working on these prerequisites from the beginning. Then the last one, in terms of doing it responsible, this is something that I think it's, again, very another aspect that we have worked from the beginning at IDB Lab with the social sector, and it's about ensuring that not just that data privacy is respected, that's a minimum, but that there are many other aspects in terms of data governance and the inclusivity of the and the representativeness of the data and the explainability of the algorithms that a lot of these digital health solutions are using, that are properly taken into account. And we can do this because we've together built very useful open source tools that you can check at FAIRLAC, the initiative FAIRLAC, and basically make all the more conceptual responsible AI frameworks that some countries have. It brings tools that can allow an entrepreneur or an investor or a government understand how to translate those frameworks into their business model or into their deployment of a digital health coverage for all. So I invite you all, if you don't know it already, to get to know FAIRLAC as one tool that from the last 4 years we've been working on to make that possible. Okay, I want to thank also, just to finish, our newest colleague at IDB Lab, who's an innovator in health, Gabriel Catan, who's working hand in hand with our colleagues on the public side, and he asked me to finish with a quote. So I'm just going to read it because I didn't know. You can't wait for inspiration. You have to go after it with a club. So innovating in digital health in the Americas requires inspired innovators, and we need to be there for them, building ecosystems that allow entrepreneurships to flourish. So that's our commitment. We will do that, and we will be able to then scale those innovations thanks to you. So thank you so much for this partnership and for the opportunity to be here with you. Thank you.
So now to hear about the experience of one of the countries leading the way in digital health transformation, I would like to invite Minister José Ruales from Ecuador. Ministro Ruales, bienvenido. Por favor, adelante.
Buenos días a todos.
Good morning, ladies and gentlemen. Let me just, first of all, convey greetings to Director Barbosa of the Pan American Health Organization, and also Dr. and President of the IDB, President Goldfajn, and all of our friends who are in attendance. It really is a pleasure to be a part of this important event representing Ecuador. Today, we are celebrating the results and the renewal of this partnership between the Pan American Health Organization and the Inter-American Development Bank that has as their main objective to strengthen the digital transformation processes in healthcare for every country in the region. It's also important to highlight that the government of Ecuador has formulated its digital agenda at the national level, and within that context, the Ministry of Public Health is implementing the digital transformation health agenda, and as part of its development plan, this is a public policy with an intersectoral approach to try to integrate the public sectors, including Social Security, and the private sector to support the healthcare and living standards of our community. We consider interoperability as one of the key principles of digital transformation in healthcare. Within the objectives established in Ecuador, we also have the adoption of the international standards, which has a single interoperable clinical history records and the integration of the universal records of patients. In order to achieve this milestone, Ecuador has also counted on the valuable support support of IDB and PAHO through the efforts of experts in designing standards, documents, evaluating the progress is made, as well as assessing successes in the digital transformation processes, in the implementation of technology solutions to have interoperable and sustainable information systems. But the support has gone beyond the institutional commitments. It's also involved many people working at the IDB and PAHO offices in Ecuador and in Washington. And let me just acknowledge, in particular, the constant support of Marcelo D'Agostino at PAHO and Cristina San Roman at the IDB, who have maintained that continuous support of the project, overcoming, in fact, changes in government administrations. And this has, I believe, validated and consolidated this national public policy. This national government strategy to achieve interoperability between the various information systems with regards to patient records really is a cornerstone for a future where we will have universal access to clinical information. Patients will have their whole clinical history within any healthcare system in real time, and also with all of the safety to protect information, so that people will now have access to their records even in remote areas. And I call on the countries in the region, I call on the IDB and PAHO to continue joining efforts in the digital transformation process of our systems in order to ensure quality and continuity of the provision of healthcare services through the creation of new connections between our nations. Thank you very much.
Muchas gracias, Ministro Ruales. Now,
thank you, Minister Ruales. Now I'd like
Secretary of Information and Digital Health at the Ministry of Health of Brazil to provide us with a brief overview of Brazil's progress.
Thank you for the opportunity to be here. Is it possible that I speak in Portuguese?
Yes, you can go ahead.
Thank you. Thank
you very much. First of all, I would like to say hello to Dr. Ilan Goldfajn and Dr. Jarbas Barbosa, our hug from our ministry in the health department and the Ministry of Health, Dr. Nícia Trindade. We are really very happy to be part of this event, and we were recently in Washington. And in the administration of Minister Nícia Trindade, a new Secretary of Information and Digital Health was created as an articulator for different initiatives that the Ministry of Health already has underway and implemented in a non-integrated manner. The first initiative has to do with information systems. We have a great health information system under Data SUS, which is the Computer and Information Department within the Ministry of Health here in Brazil. We have a department that is responsible for transforming data in indicators for monitoring and assessment, and we have a digital health department that has tried to implement telehealth initiatives. The challenge of this new secretariat is to integrate these three agencies. First, trying to integrate an interoperational architecture of all national health data, trying to integrate information systems, not only under the Ministry of Health, but information systems that are located in municipalities and states. Brazil has 27 states, 5,575 municipalities, and part of the provision of health services is done by cities in the states. So our challenge is really to integrate telemedicine with information systems, with electronic information systems and trying to provide connectivity that relies on connectivity networks, trying to make digital transformation present in all the country, focusing in the most vulnerable populations in my country, indigenous communities, the riverine communities, the communities in the Amazon region, and the vulnerable communities in urban centers. I want to quickly mention that we did have the chance during the visit in Washington, and I really want to really congratulate Dr. Marcelo D'Agostino from the Intelligence and Evidence Department at PAHO, and I would like to congratulate Dr. Sebastian. I would like to congratulate Jennifer, Irene, and all of the responsible participants. And in your comments, you made me really remember our visit in Washington when we talked about our future plans together. So it is really fantastic and vivid to talk about these initiatives following this path. And I would like to say that we identified three main key areas in this process to give continuity to our partnership together, focusing on innovation in Digital Health Lab, trying to include innovation, which is really present in the public and in the private sector in Brazil and in the Americas as a region, giving us the possibility to really focus on our national healthcare system, the SUS. This is one of our priorities. The second priority is the telemedicine implementation model to overcome the barriers and need to broaden healthcare and including indigenous communities. In Brazil, indigenous communities' healthcare is a priority in the Ministry of Health. It is our responsibility to provide healthcare to our indigenous peoples, and our Indigenous Affairs Secretary tried to implement this initiative in the Global Assembly in initiatives focusing on indigenous communities. And the third item that we established as a cornerstone in this meeting that we held with Jennifer, Irene, with Marcelo from PAHO was the use of AI in the healthcare sector. So these are the three key areas that we're currently focusing on in this challenge together with PAHO and with the IDB. I really thank you the opportunity to participate in this initiative. I would like to say hello to all of the ministers, and on behalf of my ministry, thank you very much for this opportunity.
Now we will hear the view of Dr. Christopher Dafton. He's the Minister of Health and Wellness of Jamaica.
Thank you very much, Madam Chairperson. Let me begin by saying how pleased I am to participate in this event. The digitization of health systems within the region of the Americas has never been more important or more urgent. To begin with, we are faced with an NCD, non-communicable diseases crisis, one that is especially problematic for small island developing states, including Jamaica, and which requires significantly scaled up efforts to solve. The problem of NCDs is compounded by a range of other challenges, including new and emergent diseases, and the prevailing triple planetary crisis of climate change, pollution, and nature loss, to which SIDS have particular vulnerabilities and which present significant public health risk. Pivotal to overcoming and then staying ahead of these challenges is the digitization of the health sector to build resilience so that we are not only able to withstand weighty demands on our health systems, but that we also are put in a position to recover quickly post-health crises. Jamaica is out front on digitization and is making important progress through our health system strengthening program for the prevention and care management of NCDs, which is supported by the Inter-American Development Bank. And I want to pause here to say thanks to the bank for this partnership. The program is specifically intended to strengthen comprehensive policies for prevention of NCDs, risk factors, and improve access to an upgraded and integrated primary and secondary health network in priority areas with an emphasis on chronic disease management. Already we have an electronic health records contract in place, signed earlier this year, and with implementation in train, it is anticipated that the first facility will go live by the end of the fourth quarter. We also have digital policies which have been developed to final approval, the EHR policy, the interoperability policy, e-prescription policy, telehealth policy, and private patient privacy policy, and also managed network services, ICT infrastructure have been put in place. Phase 1 is completed, and phase 2 is some 95% complete. These are together with a number of other important progress markers, including environmental impact assessment done and the start of training for the chronic care model to link informed patients with prepared and proactive healthcare workers. We know, of course, the Rome was not built in a day syndrome, and when we consider the digitized transformation of health system, the requirement is time and success in navigating several important processes. Not least of these processes, Madam Chair, ladies and gentlemen, is change management. Even with the valued proposition of digitization, cost control, collaborative care, and greater efficiency in population health management, our people have to be prepared for the transition, including health staff at the level of our facilities. Jamaica has therefore had to plan for this and onboard the varied elements of change management with leadership alignment, stakeholder engagement, organizational design, training, and communication initiated are even now being elaborated to support the implementation in the coming months and years while adjusting to emergent needs. Collaboration among professionals, entities, and countries is another important element of successful digitization. Digitization which puts in touch with each other while providing the patient with greater control over his or her information, and therefore health management is a team sport which we must engage in as a global team. Integral to successful health outcomes is data security, which Jamaica is giving close attention to. This includes using international standards like ISO 27017 and training our health professionals about the Data Protection Act for Health. In conclusion, Jamaica is keen to transform the health system of patients and their families, but also for the health staff who make it possible to deliver care to the many thousands who access the health system each day. For us, digitization means shorter wait times for patients, less cost in providing services, increased productivity, and therefore better health outcomes. It will also mean, and this is vital for us, reduce staff frustration and increase service satisfaction levels, which translates, I believe, as a win-win for all stakeholders. I thank you, Madam Chair, and thanks to all online.
Thank you, Minister. Now from Guyana, the Minister of Health, Dr. Frank Anthony, sent us this message.
On Christmas Eve in 2022, there was a newborn who was critically ill in a remote village called Guns, located near the border between Guyana and Brazil. Thanks to the use of digital tools, doctors from the Georgetown Public Hospital, who were nearly 400 kilometers away, were able to communicate with the community health worker, conduct a remote clinical examination, and determine that the child needed to be transported to the Georgetown Hospital. We are thrilled to report that this child is now a healthy 8-month-old. Without the use of digital technology, this child would have contributed to Guyana's infant mortality rate for 2022. Earlier this year, an indigenous man from a village near to Guns fell critically ill. The community health worker reached out to the doctors at the Georgetown Public Hospital, who conducted a remote examination and diagnosed that the patient had sepsis with a suspected kidney stone. As the patient required urgent hospitalization, he was airlifted to the Georgetown Public Hospital. Thanks again to digital tools, this individual was able to receive timely medical attention without having to travel 100 kilometers for several days to reach the nearest hospital by foot. Guyana is collaborating with several partners such as the Inter-American Development Bank, the Pan American Health Organization, to enhance the utilization of digital tools and platforms. This initiative aims to upgrade the quality of healthcare and to increase the availability of healthcare services to people across the country. Additionally, electronic health records will be introduced to bring citizens and healthcare specialists together to promote equality in healthcare and to address the human resource limitations. At our core, we believe that digital health tools and platforms have immense potential to benefit the public. By optimizing these resources, we can improve our chances of achieving sustainable development goals. Therefore, we urge developmental partners to prioritize digital health as a key agenda item for development. When we prioritize connected health, we strengthen healthcare opportunities across all levels, from primary to secondary to tertiary. Investing in connected health, which includes health information, health informatics, wearable medical devices, software as a medical device, personalized medicine, mobile health, and telemedicine or telehealth, presents an opportunity to achieve universal health coverage and to provide health for all.
So as we heard during the event, connecting health for all requires some basic inputs, one of which is quality connectivity. Here to tell us about the current state of the region are Luis Tejerina and Antonio Garcia Ceballos from the IDB.
Hello, everyone. Thank you so much for the invitation to participate in this important event. When we are talking about the provision of social services as such,
I got it.
Yeah, nice. Good. Thank you. So I was saying thank you very much for the invitation to participate in this event. And I was saying that when we are talking about the provision of public services as such, we realize that throughout the different sessions, the need of digital infrastructure is becoming like one of the top priorities to make sure that we are not leaving anyone behind. And at the end of the day, everybody gets connected and everybody is enjoying from those services. So what we are precisely presenting in this slide is that the digital infrastructure at the end of the day is going to be a cross-cutting aspect that is going to be fundamental for the provision of different services, particularly health is one of them. And in that particular regard, aspects related to how to improve the regulatory framework, aspects related to the data protection, and particularly the protection of the information that is actually going to be a critical infrastructure is going to be one of the key aspects to keep in mind. So, and of course, last but not least, the need of digital skills eventually is going to be important. So at the end of the day, when we are thinking about the digital connectivity, we may think about different dimensions of the problem. It could be problem number one, that is basically that the people doesn't have the connectivity as such, and then, and here the public and private partnership is going to be critical. Problem number two, it could be that even though the people has the connectivity, they don't have the affordability, the capability, the economic capabilities to pay off for those services. And then problem number three, even though the people have the connectivity, even though they can pay off, the problem is that they don't have the skills. So the combination of all those three different aspects are going to be instrumental to make sure that whatever public services, including the health services that we are putting in place, eventually can be of the benefit of everybody. So I don't know if you can please pass to the next slide. But what is the status quo in the region? So according to our estimation, we realized that these days, in order for us to catch up with the OECD, we need around $108 billion in terms of basic digital infrastructure. And the situation across different regions in Latin America still is pretty much different. So for instance, if we just compare the situation of the Caribbean or the Central American countries, we realize that there is a lot of work to be done in terms of that infrastructure, but also in terms of the regulatory framework and the institutional framework that is going to be required in order for those services to make sure that are reaching out all the different parts of the population. And as I was mentioning, it is not just about the infrastructure. It's also about the affordability of those services. It's about making the people be able to have access, quality service, but also having, having the capability of being paying for those particular services. So I don't know, Luis, you want to continue?
Now, what happens in health? In health, we have, of course, many interesting projects. We heard of many projects using in artificial intelligence, telemedicine, and many of these depend on connectivity. It is critical that when we have plans, digital health strategies, these are aligned with national digital strategies so that whenever we think about telemedicine, we implement telemedicine services in places that are connected, have connectivity, and we don't leave anybody behind. Remember that one of the 8 principles for digital transformation is inclusive digital health. Now, the situation in our region is, I would say, we painted in this map in blue all the health centers that are in places where they have access to connectivity, are not necessarily connected, but they have access. And in red, the health centers that are not. And what we can see here is that about 20%, 1 in 5 of the health centers do not have access to connectivity, which means that if you're a family of 5 and you're taking your family out for lunch, you would have to leave one of the kids behind and go to the restaurant. So at this point, I think that some of you may be thinking, okay, let's give ourselves some credit. There's a lot of blue dots. We're not that bad. It's, there's a lot of connection, right? However, think if you want to have mental health services through telemedicine, and you need to have a video conference, or you need to send an X-ray. You also need to think about the quality of that connection, right? So join me in doing this exercise. Let's paint in yellow the health centers that have slow connection and see what happens. Now, what you can see is that 90% of the health centers with slow connections are in the Latin America, Caribbean region in the map of the Americas. And if you join the health centers that cannot connect with the centers that can connect but with slow connection, that's the majority of health centers in the region, which is bad. So it's important to take into account the quality of connectivity that you can have. And in the region, if you take that into account, we're not in such a good situation. When you think about telemedicine, you need to think about connectivity. You need to think about the gaps. And what you see here in the map are the urban-rural gaps. And you have many countries in the region that have not only low coverage, but also big gaps between regions. And if you were to implement a digital health project, you would be incrementing inequities in the particular country. So it's very important to take into account these and prevent for these and invest in closing these gaps and improving coverage in the region. Now, at the bank, we're being very proactive in this, and we're developing tools so that we are closing these gaps and being responsible in inclusive digital health. And Antonio will tell us about one of these tools. Antonio.
Yeah, thank you so much, Luis. I think that it's important to keep in mind that the magnitude of the problem depends at the end of the day on what is the location of the center, or what is the population that we want to provide the service to, how the people are distributed matters, where the location of the center matters, and eventually it has a clear impact in terms of the financial requirements. So that's why at the moment we are working on a particular platform that is trying to identify several things. First, what is the magnitude of the gap? So what is what we are talking about? Keeping in mind that this is not just a public sector problem, but it's also a problem related to the private side. So we need to understand that depending whether the center or the institutions that we want to provide connectivity is a rural or an urban area, the cost may be one or another. But it is not only about that, it is about defining the type of projects that we may think of. It may be a project related to how to provide the connectivity to that location that is in a rural area, or it could be how to improve the connectivity across different institutions throughout the country. So it may be the case that I'm talking about the same thing, but in terms of the financial and in terms of the technical solution, it may be one or another. And the other thing that we are trying to do is, okay, we have all the maps that are presenting where the different institutions are located. We have a better understanding of what is the magnitude of the gap. Okay, we know a little bit what may be the project from a technical standpoint looking like. Then we need to understand what is the impact that this project may have. So how we are going to be benefiting the population, keeping in mind, as I was mentioning before, that the infrastructure is going to have a cross-cutting aspect that is at the same time as we are connecting one particular location, we may be connecting the school, we may be connecting the households, or we may be connecting the small, medium enterprise businesses that are in the area around. So the impact are having spillover effects that needs to be considered whenever that we are deploying that particular infrastructure. And eventually, this is going to have a clear impact in terms of the SDGs as well. So precisely these days, along with the leadership of our president, we are precisely working with the International Telecommunications Union and UNDP on having a better understanding on how digital infrastructure could eventually, contribute to the achievement and the SDGs that we are defining. So even though there are SDGs for many different sectors, when we think about digital infrastructure, it may have a great impact and, let's say, like a multiplier effect on the different SDGs. And this is part of the discussion that we need to bring into the equation too.
And of course, we want projects that close gaps, not make them wider. And we're working also in a framework that will help teams analyze the projects and the potential impacts in all the dimensions that Antonio was mentioning at the beginning. Access, digital skills. There are things that maybe for which you may need regulation or to look at regulation so that you don't increase gaps, but actually close them. So we're working on a framework that will allow teams to not only to identify the risks in making inequities wider, but also in thinking about mitigating tools so that when you develop a project, you also think about the necessary investments in a way that helps us avoid leaving anybody behind in the digital transformation of health in the Latin American and Caribbean region. Thank you.
Thank you so much. To hear the key takeaways and next steps for digital health transformation, I invite Marcelo D'Agostino from PAHO, Pablo Barraran, Social Protection and Health Division Chief from the IDB, to join me in the stage to share their ideas.
Ahora sí. Bueno, primero quería felicitar a Luis, colega, por la presentación anterior. Es impresionante.
Well, first I want to congratulate Luis and all the colleagues for their presentations. They've been wonderful. And well, what we are proposing is first to take advantage of this concept that we have, or that we were discussing with Sebastián this week. We have all the planets aligned. And posture of the president of the IDB, of PAHO, everything that the pandemic catalyzed with all of this. So this is what we're looking at, to take advantage of this alignment that we have and continue to work with PAHO to strengthen these information systems. To us, this has been a very important milestone that we are, and next year we will be presenting the progress report of the 5 years of the strategy. with which we want to have a renewed strategy.
Tercero, ya lo mencionaba antes y se mencionó.
Third, as I mentioned before, and now that we see this presentation, I wanted to add an additional takeaway to apply this data science and connectivity for the health sector. In this way, we can advance with this guiding principle in the health sector for 2030. And then we thought about promoting the concept of digital transformation in primary healthcare. We have the presence of Dr. Fitzgerald, and we are currently discussing what this whole digital transformation means in primary healthcare. And then to work on all of this, to connect the people that are disconnected. And it would seem very simple to say, okay, just stay home in the presence of a pandemic. We are promoting the concept of staying connected at home, and for this we need to do a million things. And finally, to continue to include new partners, we appreciate the presence of Blueberry and Philanthropists here, and many others that continue to become part of these initiatives. And with this, on behalf of our organization, we wanted to also invite you to be alert, because with the IDB, we are organizing from November 12th to 14th a regional meeting for the digital transformation of health in the Americas. And this is the result of a discussion that we've had with Dr. Barbosa, the president of the IDB. So on November 12th, we want to thank the government of Brazil, Dr. Silva, who is connected, to be able to advance towards cross-boundary interoperability. We've learned a lot from IDB Lab, blockchain, etc., and we've been expanding from there. And today, our colleagues in Geneva are holding weekly meetings with the IDB team to be able to expand that globally. So with this, I now give you the floor.
Thank you very much, Marcelo. Let me just express my thanks to the ministers who participated in the event. We were happy to have Minister Frank Anthony, Jose Ruales, Christopher Tofton, and Secretaria Haddad. And I think the insights that they shared are really why we're here. They are the leaders in transforming the health system, applying digital tools, and therefore their vision is key in shaping the future steps of the initiative of Connected Health for All. We saw by the stories that were shared the importance of embracing innovation, the importance of embracing technology to improve the services that people receive and have a real impact. Today, and we've been talking about how we work in terms of connections. And I think whether connections are human, are technological, or supported by technologies, they are a social determinant of health. And that's why we focus on this as a key aspect. The ministers shared how programs to connect people, for example, through the information systems for health, but also to connect data that allows people to receive better care and allow policymakers to design better policies. And also connections of trust between governments, the ministries of health, and their peers, for example, the ministries of digital government, the ministries of transformation, and also, and most importantly, trust with the communities, with the people that they work with. And I think this is an important basis, and that's what we mean by connecting health for all. In the visits that I have the chance to do, and most of you do regularly, we see the enormous opportunities of improving health and really reducing, for example, the time that people wait to fill a prescription or to see a specialist. And also the huge potential of developing tools so that we can help nurses and doctors to have the right information at the right time to improve the services that they provide to the people. And this will translate into savings, but most importantly, into more healthy and more productive societies. And I want also to stress the importance of collaboration between international and national level, collaboration between levels of care, collaboration between the public and the private sector. All of this is necessary to foster innovation and to improve services and make the reality of connecting for health. Why? The president mentioned this morning, and we also talked about this, is the idea of a Pan-American highway for digital health. And we need to be ambitious and set important goals. The region of the Americas is not new to this. It's almost 30 years ago that the World Health Organization declared the Americas the first region in the world to be polio-free. So why not aspire to be the first region in the world next year to meet the standards set by the WHO in terms of digital certification of vaccines? It's something ambitious, but something that we can do. And we can really come together to build a more connected, equitable, and healthier reality for the people in the Americas. It shouldn't matter where people are born, or if people have to move across town or to another village or another province. They should still be connected to health, have access to their data, and be empowered to take care of their data. Marcelo just mentioned that we will be paving this highway in November, hopefully with 15 countries that are confirmed. Hopefully more will join, and this will be the second connectathon to continue to show how this can be done and showing concrete results. I'm very happy that this alliance between the IDB and PAHO supporting our member countries, this was something emphasized. We work at the demand and to help countries meet their goals is the correct way to move forward in this agenda. And I hope that this is a call to action to more countries, more partners to join in these efforts to transform health using digital tools. Thank you very much.
Thank you so much, Marcelo and Pablo. The key to what we do is the impact we can achieve. So hearing your views is really inspiring. Now for some final remarks, I would like to ask Dr. Marcos Espinal, PAHO Assistant Director, and Fernando Regalia, Social Sector Manager, to join me in the stage for some final remarks. Dr. Espinal, please go ahead.
Okay. So I'm going to be brief because probably people are hungry and they wanted to go and enjoy some lunch. But I'll say a few remarks. I can retire in peace, Fernando, now, because Fernando and I goes back many years, and it's really pleased to see the progress of these partnerships since the time we started with that famous trust fund for NTDs. But that's another story, you know. So not only this, malaria also. I mean, this is a healthy, excellent, outstanding partnership. And why I said that? Because it's for the benefit of the people of the region. And most of the people here knows what this region is. It's very resilient. It's full of human resources. It's full of good people. And we care about this region because most of us, if not all, come from countries of this region. So congratulations to IDB, to PAHO for taking this forward. And to the partners, USAID, Bloomberg, CDC, Vital Strategies, and I'm sure many others that will come. And when I said I can retire in peace, because 7 years ago, when Marcelo and I started talking about this, I said, well, and I saw that famous maturity model. I saw it in a tiny slide. I said, this is going to take time. This is going to take resources. But this is going to take resiliency also. And look at what it is. And Minister Frank Anthony took my quote, because I was going to say, I see this when a child is starting to walk, primary school, secondary school, I feel now the child is almost graduating for his PhD, you know, because the rest, it's the most difficult thing is at the beginning. Why? When we talk about 18 countries, I think you mentioned 15 countries for the next connectathon. These are where our gratefulness should be. The member states of IDB and PAHO, the countries of the region. These two agencies are owned by the countries. And when the policymakers and our ministers of economies and finance and they commit to this, and the president, the head of state, the head of governments commit to this, this is where success is. And to me, this is a car without reverse.
Ferdinando. So it's just very overwhelming to see the progress of this, and the hope is this is it's not a 100-meter race, it's a marathon, and I'm sure we will get there at some point. So thank you to the countries, thank you to the partners, and let's make sure we continue supporting this, because this is for the benefit of the current and the new generations. And if we keep committed, it's not about me, it's not about the people here, it's about the people in the region. It's about people living in situations of vulnerability. It's about everyone in this region. And we can do it because we were the first one to eliminate polio, smallpox, and so on. We can be the first one to get that highway connectivity. Thank you very much. These are my final thoughts.
Thank you, Dr. Espinal, and good morning, almost good afternoon to everyone. And after your words, I need to change my talking points because when someone announces retirements, it means that for all the others, we cannot retire because we have a big agenda in front of us you give us as a legacy. Now, besides the initial joke, I really want to express my gratitude for these 5 years of great collaboration among these two institutions, and particularly the countries that we serve. Unfortunately, I don't have enough time to mention the contribution of everyone who has made this great journey possible until here, and who's going to make this journey possible going forward. Please allow me to thank PAHO Director Jarbas Barbosa and his team for prioritizing information system and digital health in our region. I think together we made significant progress, and as we heard today from our two principals, we will redouble the efforts to soon achieve universal connectivity in the health sector. I also want to give a special thanks to the honorable ministries and secretary who join us today, because they are really the face of leadership in the region on these matters and many others. And also special thanks on our side to the government of Israel, Japan, and Korea for their really invaluable support in this agenda. I also want to recognize the leadership of all the countries of our region. They are leading this work. Among them, the 15 countries are already part of LACPAS. Really, your efforts are setting new standards both regionally and globally. And finally, I would like to highlight three main ideas that were shared in this seminar. First, we all talk about health transformation, and health transformation has always revolved around innovation, in pushing really the boundaries of creating new solutions. And we firmly believe that digital health provides new venues for health systems to transform the way they provide care. And today we heard many examples to foster connection or better connection between providers and users, empowers the patients, allow for better disease prevention, enhance access to diagnostic tool and better quality care, and reduce errors. The potential is vast, and we are just scratching the surface. What is also interesting that this potential is also tangible and measurable. And the second point is that digital transformation is not only about adopting new technology. This has been said over and over again today, but I think we need to stress this. It is about creating systemic changes in the way healthcare is provided to pursue more equitable access, more measurable quality, which for us is really a priority, and more returns for each pesos, dollars, or any other currency invested. And it's also about investing in the people who work in the system, because they are those who actually lead this change. And finally, I cannot stress more how important has been this area to strengthen our collaboration with PAHO and with other partners. And really this is a call for more countries and more partners to join this effort. An effort which is based on country leadership. Dr. Espinal just mentioned once again. I think it's important. We go nowhere without country leadership. It's focused on supporting the development of national strategy for health, or digital strategy for health, that are connected to the national e-strategy and digital transformation of governments, with clear objectives. And because we are setting the seeds for this strong basis, we can also very quickly move to the cross-border issues. And what has been achieved in the last 2 years was almost unthinkable when we started the alliance. So we are showing that together we are really much more. I know this seems cliche, but this is not a cliche in this case. We are more than each parts working individually. So thanks for joining us today in this event, presentially and online. Let's really continue working together to make Connect Health for All a real reality in our region. Thank you very much.
Thank you all for joining the event, and to the IDB and PAHO teams that made it possible. The recordings and the presentations will be available on our social media channels and on the event website. We hope you have a great afternoon. To those who continue your agenda at the bank, you can stay here and we will guide you to the next venue, okay?